Hello, everyone. Thank you for joining us for the Foothill College COVID Vaccine Education Series presented by the STEM Division and Science Learning Institute. My name is Ram Subramaniam. I serve as the Dean of the STEM Division at Foothill College. This is a four-part series to learn about various aspects of the COVID vaccine, biology, public health information, myths, and also about our county information. Sophia Kim, Rebecca Ryan, Diane Denagel, and Sarah Cooper are the co-organizers of this program. I'm now handing over to Sophia Kim, who will go over some logistics regarding this webinar.
Good afternoon, everybody. My name is Sophia. I am the director of the Science Learning Institute at Foothill College. Thank you all so much for being here. Just a few housekeeping items for today. We've disabled the chat, as you will notice. That's just to enable us to be fully focused on our speaker. We do have a Q&A option, though, for you. If you look at the bottom tab of your screen, you should be able to post questions. We're going to save the questions for the end of the talk today, unlike we did last week. So please feel free to post questions as you will, and we'll take care of that at the end. There's also an upvote option, which allows you to select if you like a question, don't want to repeat yourself, please feel free to do that. Our webinar is being recorded and it'll be posted on our webpage, which we'll also post, I think, in the Q&A section, if we can do that. And just wanted to let you know we have two interpreters with us today, Alicia and Debbie, who will be signing for those of you who need that access. And that's it for me. Back to you, Ram.
Thank you, Sophia. It is with great pleasure and honor that I introduce today's speaker of this education series. Speaking to us about the public health context of the virus and vaccine is Dr. Rebecca Ryan. Dr. Ryan is a health instructor at Foothill College and teaches classes such as health and social justice and health across the lifespan in the dental hygiene bachelor's degree program and several other classes. Dr. Ryan's undergraduate degree is from CSU Sacramento. She obtained her master's degree in public health from San Jose State University. Dr. Ryan obtained her doctorate degree in health behavior and human sexuality from Indiana University. Besides teaching classes at Foothill Health Department, Dr. Ryan has been actively engaged in various campus initiatives. She is running a contact tracing program through Foothill College's community education program and is more recently involved in developing a Foothill contact tracing app for students as we return back to campus in the near future. Dr. Ryan is also developing coursework for a community health worker program. So please help me welcome Dr. Rebecca Ryan.
Thank you so much. Just hearing that list, I was like, wow, that's a lot that I'm doing. I'm a little bit tired, but thank you so much for having me. Thank you everyone for being here. I looked at the participant list. I'm excited that I see current students. I see former students. I even see students back from high school when I taught at Irvington High School. Before I begin, let me go ahead and share my screen, and I want to give an overview of some of the things I'm going to go over. So you should be able to see my screen now. Can I get a thumbs up from our interpreters that you guys can see my screen? Awesome, thank you so much. The goal of public health is to promote and improve the health of our communities, which includes preventing COVID infection. As a public health educator for nearly 15 years, my personal and professional aim has been to equip students, both children and adults, with the tools they need to be informed and make the best healthcare decisions for their lives. That's my goal here today, to help answer questions that have been lingering in our community. To start, I'm going to take a community-based approach, which allows us to think of about the work that we're doing with vaccines as a collective approach to protect us, including you, the individual. So all of us here together, including those joining in live and those on recordings, I say thank you to my students, my family, hi mom, hi dad, colleagues, and our whole community for joining, because we're in a community together. Even though this pandemic at times, most of the time, forces us to feel quite isolated from each other. Today, we'll talk about how a community-based public health perspective can be really helpful in minimizing COVID by our individual and collective efforts with vaccination. There are some real concerns about vaccine in the community. I had them too, absolutely had them. I get frustrated when those concerns are muted, and truly know that answering those concerns and doing some research on those concerns, being honest about what we know and being really honest with what we don't know is vital for all to establish honesty and integrity. When thinking about the public health response during the pandemic, it is clear that no response has been perfect, and some approaches were quite awful. I think it's really important for public health to admit what they did great, but really to admit what they did that wasn't so great. I empathize with those of you that are confused or scared or worried about the vaccine, angry that we're not fully reopened yet, terrified for the states and the countries that are increasing in hospitalizations and test counts and in deaths. I'm afraid that another spike will come back to our Bay Area, to California, to the US as a whole. We're not out of the woods yet by any stretch. However, because of vaccinations, California and the Bay Area are moving closer to the end of this pandemic, more so than ever before, because of individuals that are choosing to wear masks, that are socially distancing, that are getting vaccinated, primarily because of vaccinations. So come with me and let's explore some of the most common concerns with vaccinations so that way we can get back to the things that we've wanted to do in a life that we want to lead. So as I start, I want you to imagine, what does the pandemic, the end of the pandemic, look like for you? When we think about learning, how many of you are frustrated with Zoom learning, Zoom teaching, Zoom everything, including this webinar? You want to be in person. Is this more of what you're thinking about? How about for children, elementary school children that are in the segregation, whether they're through Zoom or have dividers? Let's think that the end of the pandemic can bring back story time and engagement with children without having to separate and segregate them. Birthdays no longer need to be drive-by and depressing. I've seen this in my own neighborhood. Instead, it could be collective, whether it's for children or teens or adults. Instead of holidays shared around a Zoom room, they can be in person, enjoying our friends and family without being scared or in fear of them. Becoming an active member of the community can be with each other, not behind screens, behind panels. Going to concerts can be fun and engaging. Everyone can get back into crowd surfing if that's something that interests you, or that's something that you want to do. Going to or attending or being a part of performing arts. Travel, whether on airplane, ship, etc., can be maskless and fun. Although this picture may not be truly representative of everyone's flight experiences, just imagine the difference of not having to wear a mask on an airplane. And one of my favorite places to travel is Walt Disney World, and I can't imagine going on every ride alone or social distancing, especially wearing masks. So when I think about the end of the pandemic, I think about children engaging with the characters that they love at Walt Disney World and enjoying everything that a vacation should be. So what is your reason? I want to share some personal information for you. When I think about my reason for ending the pandemic and the reason I got vaccinated, it starts with family. Not only wanting to see my family again, because truthfully, I haven't seen most people in this picture since 2019. I want to ensure that I'm protecting them. That was a huge reason that I got vaccinated. So just a caveat that I think it's important for me to share with you is that we were tragically and deeply affected by COVID-19 early on in the pandemic. This picture here, this is my father-in-law, John. He was my father-in-law. He was nearing retirement and planning to travel the country, visiting family back in Pennsylvania and exploring all the beauty and sights that he could. He became ill with COVID late March, early April 2020, very early on in the pandemic, before we really knew a lot about it. He was hospitalized on April 16, 2020. At this exact time last year, my dear husband was not allowed to see his father, but instead spent day and night communicating with doctors, his father, extended family, trying to understand what was happening and begging his doctors to save his life. His dad was very cognitive of everything that was happening. And like COVID, it happened exactly as the doctors predicted. The ventilation, the suffering without oxygen, and trying everything they could. My father-in-law's life was taken by COVID on May 7th, 2020. When you think about it, all of us in this webinar have had our lives completely ruined by COVID. We've been robbed of birthdays, of holidays, holding new babies, celebrating successes, attending funerals of people that we love, graduations, whether our own or other people's, sporting events, vacations, the ability to get toilet paper. There's been so much that COVID has changed, and my father-in-law and over 3 million people worldwide won't get this opportunity to have post-COVID dreams fulfilled, but our collective efforts can help reduce this burden for people we care about the most. For this reason, I'm incredibly passionate about ensuring that no other family has to go through what nearly 569,000 American families have had to go through with losing a loved one to COVID. COVID is a fast disease. It's not years, it's not months, it's weeks. Vaccination is one of the most effective ways to reduce COVID. So what is your reason? The objectives of this talk today are to go over the difference between influenza and COVID, to talk about vaccines from a preventive approach, address vaccine concerns that are truly within the community and need to be addressed, looking at the Johnson & Johnson pause, and finally, to challenge you, our audience, in finding a reason and being an advocate. So to briefly address the difference between COVID and influenza, there's a lot of similarities like fever, even leading to pneumonia, but hospitalization with COVID is very different, including an increased need for ventilation, longer stays in the hospital, and nearly a 5-time risk of death. But not only death, other complications that flu doesn't necessarily see. So when we think about influenza, a lot of people say, well, people die of flu. I hear that a lot. People die of the flu can hurt people. Or I hear the opposite. COVID's like the flu. A lot of people get it and not a lot of people not a lot of people die from it. Looking at the death rate, there's a huge range. We know that in the past couple of years, influenza has been really problematic, minus 2020. So we look at 2019, 2018, and beyond. There's about 290 to 650,000 worldwide. This is a worldwide death rate. Worldwide, there's been over 3 million deaths associated with COVID-19. So when you look at those two numbers, we can see that, yes, there's nearly, in fact, if you compare year to year, it's a little bit over the 5 times death rate associated with COVID versus influenza. They're not the same. They have a lot of similarities, but they're not the same. This is just a little public health plug. Fall is the time for flu shots. It's still important to get those flu shots. Just like we're vaccinating for COVID, still vaccinate for flu. So let's look at vaccines, preventive versus treatment approach. A lot has come in the media regarding herd immunity and why it's so very important to think about, but also to address some of the misconceptions with herd immunity. So herd immunity is really important to understand with transmission, how viruses spread between people. Transmission is reduced when most of the population has immunity. When the population does not have immunity like we had in 2020, and even this year when a lot of people still are not fully vaccinated, viruses travel easy. I like to think of the term, and a lot of public health officials will agree with this, instead of herd immunity, it's more like herd protection. Because when you have a large population of people that have been vaccinated, they have the immunity. Not everyone does. So we like to think about it as the immune people are protecting the people, especially those that can't get vaccinated, those that are immunocompromised, from getting sick. So what is the percentage? A lot of people ask, well, how many people need to be vaccinated? It depends. Measles needs like over a 90% vaccination rate to fully protect the population because it's so easily transmissible. A lot of estimates are out there between 60 and 80% for COVID-19 specifically. But what's really important is even if you have those figures within like the United States population, you're still going to have pockets of areas of low vaccination rates where you see outbreaks because you don't have that herd immunity or herd protection within those communities. That's why it's a community effort. We want to make sure that communities are vaccinated. So let's look at herd immunity successes through vaccination. MMR is a vaccine a lot of people get as children. So you have measles, mumps, rubella, pertussis, chickenpox, polio, etc. These are successes. These were done through vaccination efforts, not through natural, everyone get it and then everyone has immunity. So remember, skipping vaccination and relying on natural herd immunity where everyone gets COVID and then everyone's got antibodies against COVID is a dangerous proposition and it's never successfully been accomplished. Why is this dangerous? Because it leads to loss of life. Look at the numbers that we've had, over 569,000 Americans within the past year. Also, look at the other things that happen. We think about long haulers who have COVID, who have recovered from the virus, but still have problematic and systemic disease from that. So here's an example. I think Dr. Sarah Cooper had a very similar, and she was my inspiration for this, having a graphic. Vaccines create immunity without causing illness or resulting complications like the natural approach. Remember, there's been no, I'm going to go back real quick, no successful vaccination for people that have relied on natural immunity. It's always vaccine approaches. So this person in the middle is COVID positive. And because we are naturally congregating in the community spaces, it's easy to pass it on, which is why there's been so many COVID-19 cases worldwide. But when you have most of the people are vaccinated from COVID-19 and get boosters, because boosters are going to become normalized. Boosters are a normal part of vaccination. Even Pfizer said that there's probably going to be a third booster or a third shot recommended, which is totally expected. Then you have protection. And so it makes it a lot harder for disease to spread, which also makes it a lot harder for variants to happen because mutation of virus is normal. That's what viruses want to do, but viruses cannot mutate without human hosts. Why are vaccines important for young people? I get this question a lot. Even I'm going to shout out to you, Nicole. Nicole is one of our contact tracers that works with our group. She relayed something that a lot of people say. It's like, I'm young, I'm probably not going to have a serious COVID outcome. Why do I need to get vaccinated? I can wait on that. I'm not at risk. And the reality is true. Younger age demographics don't have the risk that older age demographics do. But because it's so transmissible, and because it's passed between people, it's so important to get that herd immunity, to get the mass majority of people who can get vaccinated. So vaccines have proven to reduce infectiousness, which means how they transmit between people. Also, it helps to reduce the amount of days that someone is infectious and the viral load in case they do get COVID-19. It's not impossible to get COVID-19 after getting vaccinated. The whole point in the vaccination was not to prevent 100% infection. It was to prevent most infection and also to reduce the seriousness of that infection. So vaccinations also reduce the opportunity for mutation, like I said. A new report have come out, and I have all the references here for everyone if you want to go through the reference list, that the UK variant is between 55 and 61% more deadly. And that's a variant that is within Oregon right now. It's the most common variant and common coronavirus within Oregon right now, who is facing a potential new peak. So vaccines, what do they do for the immune system? They prime them so that way when coronavirus does enter the body knows how to react to it and to fight it, versus relying on getting it and getting antibodies against it and hoping those antibodies can work against all new variants and mutations. The goal with vaccines is to reduce the serious effects of the coronavirus. That's why it's vital for people to get vaccinated. And a lot of people say, which vaccine? There's Johnson & Johnson, Pfizer, Moderna. And then if you're overseas, there's all different ones. Get the one that you can get, whichever one you can get. And if you're questioning me right now, like, but that Johnson & Johnson one, I know there was a pause. I know what you're thinking with that. And I have a whole segment in this talk just for you. So remember, if the virus can stay in younger people, maybe it's not that big of a deal. But the reality is we're humans. Humans are in contact with other humans of all age ranges. It transfers, it passes, and then it puts a lot of people that are sick or that are older and immunocompromised at risk for serious complications, including death. So vaccines work best at a population level because of what individuals are collectively doing. The individual is part of a bigger society. So that's why we think about population level approaches, because those have been proven effective with all previous vaccines. If you want to go into detail and if you want more additional information about the biology of vaccines and COVID, you can access Dr. Sarah Cooper's talk that occurred last week by visiting our education page. That's just a little plug for you, Dr. Cooper. So this is something that I put in here that made me laugh out loud because I love comedy. You know, if someone might say something like polio, never heard of anyone I know get polio, entire US population since 1979. That is one of the greatest things about vaccinations. You don't hear anyone getting polio in the United States because it hasn't happened since 1979. Why? Vaccinations. My goal and my dream is to see a quote like this: COVID-19, I'm glad the pandemic is over. Or even, I haven't heard of anyone getting that. We don't know when that will be, but the sooner everyone can get vaccinated, or the people that can get vaccinated do, the sooner we are to the end of this pandemic. So I created a chart, and I don't want to scare people with a lot of this information, but I wanted to take a look at some vaccinations that are recommended and required for school entry. The first two are required for school entry. Now we go back to 1955, that was when polio vaccine was released, 1981 when hepatitis B vaccination was released. And then we look at the newer vaccinations. Obviously COVID is super new, but HPV, if anyone knows me, my background is sexual health, HPV is my jimmy jam. I love the HPV vaccination because it prevents cancers. It prevents warts, which can prevent death. In fact, all of the vaccinations here prevent serious health effects, including death. So that's what vaccines do. Now, when people get vaccines depends on the vaccine itself. Like HPV is recommended in childhood before sexual activity, whereas polio and hepatitis are, actually polio is one that you get at birth. Hepatitis B is at birth and polio is in infanthood. Same thing with hepatitis because there's a series of vaccinations. In fact, this is some really cool stuff about vaccines. Vaccines for hepatitis B weren't super effective in the population until the universal vaccination started at a younger age in infanthood and birth. That's when they started to see the effectiveness happen because it's so transmissible. Now, some noteworthy caveats that I want to include here is HPV has a lot in common with vaccination, with the thinking about COVID-19. There's a lot of people that say, I don't want my kids to get vaccinated for HPV because they're not having sex yet. And a lot of people say like, oh, maybe the HPV vaccination, like I don't need to get that because it's not a big deal. And you hear that kind of thinking around COVID. Well, it's not going to affect me or it's not that big a deal. But remember, vaccines work before you get infected. So it doesn't make sense. And a lot of people they try to get the COVID vaccine when they're already sick because then they're kind of scared. Vaccines have to be done before you get that virus introduced into your body. It takes time to work up. Pfizer, for example, takes you get your first dose and then you wait 3 weeks, then you get your second dose, then you wait 2 weeks until your immune system is fully ready. Same with the other vaccinations. For those that love charts, I will absolutely send this PowerPoint to you so you can go through this table. I think it's just really important to understand that polio and hepatitis B have been very effective, especially polio, in eradication of new cases. HPV has low uptake because a lot of people have cultural reasons why they don't want to take it or emotional reasons. And I'm afraid that we're seeing that with COVID. People have emotional reasons for not getting it. And I'm glad you're here today to hopefully learn about vaccinations to help people around you. A lot of people ask or talk about vaccine efficacy. They look at rates like how effective is it? Efficacy is a word that's used in clinical trials. Effectiveness is used in regular everyday approaches with the whole population. So let's just jump into efficacy quickly. So the vaccine efficacy is a measure of the proportionate reduction in disease among vaccinated people. So Pfizer, for example, has 95% efficacy. So, but what does that really mean? 95% effective does not mean that it's effective for only 95% of the population. And then the other 5% of the people, you're going to get sick. Like, sorry about that. That's not what it means at all. It actually means so much more. It means that vaccinated people in clinical trials, which is over 40,000 people, half getting the vaccine, half getting placebo, had a 95% lower risk of getting serious complications of COVID. And that actually equates to 20 times lower risk. So it's a huge reduction in negative outcomes of COVID. Also, it actually shows that to be like, if people get it, it's usually asymptomatic infection. And it's important to avoid comparing Johnson & Johnson efficacy, which is 67%, with Pfizer and Moderna because they were in different populations in different times. Johnson & Johnson happened when variants were emerging. And I know people will be like, well, variants, isn't that something to be worried about? Yes. The quicker we can get everyone vaccinated, we reduce the amount of variants that are here in our population because the virus is not spreading so quickly within the population. When you have viruses spreading, they're naturally going to mutate. When they mutate, that's where those scary variants come from. Some mutations, not such a big deal. The UK and the South African variants, those are the ones that you hear about because those variants tend to be a lot more serious and they tend to spread a lot more within populations. So it's also important to know efficacy numbers are protection from having symptoms, not protection from being infected. Remember, no symptoms are great because without symptoms, you don't have those hospitalizations and you don't have the deaths. Critically important, Pfizer, Moderna, and J&J vaccines are effective in preventing those serious. And I keep saying that over and over again, but I think it's so important to know that if you get COVID after being vaccinated, and I will discuss breakthrough infections, that most likely a breakthrough infection is not a big deal. It's the thing we want with COVID, which is if we get it, it doesn't hurt us, versus 569,000 people that died because of COVID. Will I have to have a COVID vaccine? I get this question a lot from people that are on the fence about it. Like, can I just not get it? Can I just be a person that's, I get to benefit from herd immunity? Well, here's the thing. If you're immunocompromised, that's a completely different topic. But once vaccines are fully approved by the FDA, they may be required for school entry. We know that the CSUs and UCs already put out a statement last week about requiring them fall 2021 once they're approved by FDA. We know that people for places of employment will require them. Travel. If you want to travel, you actually get some benefits. So Europe may open for vaccinated Americans starting this summer. That just came out as well. I have the link in my references for your benefit. Sporting events. I know the Golden State Warriors, for those Warriors fans, they put out a statement that you need to either show vaccination or have a COVID negative test. So the CDC puts out a lot of other benefits for vaccinated people. Please note that there's a lot of benefits from not having to quarantine for those people that are traveling. So let's go into the vaccine concerns. A lot of people wonder, does it hurt to get vaccinated? I hate needles. Trust me, when I got vaccinated, I've had both shots of Pfizer. I couldn't make eye contact with the person that was giving me the injection because it's just not a fun experience, but I did not feel it. And that's something that I hear from a lot of people, that they didn't quite feel it because the actual needle is smaller than a pencil point. It's smaller than most needles that are used in medicine, which is great. Side effects, do you feel it? I did have side effects from the second. And some people worry that if you don't have side effects, it's not working. That's not true. There's like a weird bell curve. Some young people say they didn't get side effects. Some young people say they did. Some people that are kind of middle-aged say they did. Some say they didn't. Same thing for older populations. The symptoms do resolve quickly. Like I said, I had symptoms. They were kind of like flu-like. I had a little bit of chills. I had a headache. But once I was over that, like within, I think it was 24 hours, I felt normal. I felt totally fine. It wasn't like recovering from the flu. Let's talk about breakthrough cases, which are really important to talk about and not to ignore. So this occurs when someone's been vaccinated beyond those 2 weeks, because they would say wait for that 2-week period to make sure that the COVID positive test that you have wasn't because it happened during the middle of vaccination, which does happen. Vaccines are not 100% effective in preventing COVID-19. The goal in that is to prevent the serious outcomes of COVID-19 and also to eliminate COVID in a population. So it's important to avoid contact with others until after 2 weeks after your final COVID vaccination. It's going to allow your body to build up the strongest defenses against COVID. And again, it's important to vaccinate the population for those people that can to prevent the variants, which are really responsible for a lot of the breakthrough cases. So this is the most updated chart that I got from CDC. And I did some calculations. So of 87 million people that have been vaccinated as of April 20th in the United States, only 7,157 had some kind of breakthrough COVID infection. And if you're wondering statistically what that is, that's 0.008% of all vaccinated people, not 1%, not just less than 1%, but 0.008%. And a lot of people will jump down to the death rate. And I don't want to confuse you on this, so I want to make it very clear. This 1% is of people that had breakthrough cases. There were 88 deaths associated with COVID infections after vaccination, not because of the vaccine. The vaccine did not cause these deaths. It's not 1% of all people that were vaccinated that died. It's of the breakthrough infections, 1%. I did the math and I rechecked it. Thank you, math teachers, for making me recheck and drilling that into the head. Of all people that were vaccinated, 0.0001% died. That is so slim. And I'll talk about those kind of percentages when we get to the J&J pause. How to prevent breakthrough infections? You keep using your masks. I know the masks are annoying. I feel like I'm a Mortal Kombat video game player whenever I have my mask on. I understand it's frustrating. We still need to keep up hand washing and sanitizers. The amount of people that talked about how they never really washed their hands before the pandemic was shocking, but I'm excited that's a new practice that people are starting. Don't stop that. Keep up social distancing and encourage vaccinations. So again, I want to talk about Oregon briefly. Right now, entering another wave. Many new infections are in the unvaccinated groups and are caused by the UK variant, which is incredibly transmissible. Vaccinations decrease the amount of virus being transmitted, which reduces the opportunity for these nasty mutations and variants to form. That's why it's so many protective things that vaccinations do. It's not just on the individual, but it's within the community itself. So why masks and social distancing if vaccinations are effective? Many of you have probably seen this. I love this meme. I love anything funny, but I love memes. And this is like a really great kind of counter example, not counter, but another example. If the airbags work, then why the seatbelt? If the seatbelt works, then why the airbags? If both works, then why the brakes? When you think about driving in a car, you want all of these protections because you don't want anything bad to happen to you. Same thing with vaccinations. It's not just vaccinations alone, but in concert with masks and social distancing. A lot of people have concerns about the vaccines being too new. We know that the 3 vaccines, 2 of them are mRNA technology, and the other one is an adenovirus from Johnson & Johnson. We know that these types of vaccines are not brand new. They've been in production for a long time for whether it ranges from Ebola to HIVs, rabies, and Zika. They're not necessarily new in the way that a lot of people have been concerned about them being new. What about the long-term effects of the vaccine? This is a question I had myself. Legitimately, of everything that I researched, with COVID, I wondered, well, how do we know when long-term is long-term when it comes to vaccines? How long are they studied for? So I looked at historical data because truthfully, one of the best ways to know about what's going to happen in the future is look behind you and review historical data. So long-term effects of prior vaccines include measles, mumps, rubella, polio, etc. They really didn't necessarily have long-term issues when we think about long-term, 6 months, a year, 2 years, 10 years, 50 years down the line. Adverse events are what most people are concerned about, something happening to the body, death, sickness, illness, etc. Usually occurred within 8 weeks. That's the mark. That's what history has provided us, that nothing really happened with any of the vaccines. Actually, nothing happened with vaccines after the 8-week period because of the vaccine itself. And because of the knowledge gain, that's why the FDA requires companies to follow trial participants for a minimum of 8 weeks before they can even submit. We know that clinical trials last usually a few years. So there's a lot of people behind the scenes that are analyzing this data. We look at Pfizer, for example. They've enrolled 43,000 participants to date, 41,000 who have received a second dose of the vaccine candidate as of November 13, 2020. So we know that's 5 months. We know that those adverse events, whatever they may be, occurred right after, not months later. So we have data already. That data does exist, and it's been provided to the CDC and FDA. Now, there's concerns over 5G and COVID-19 vaccines. There's a lot of conspiracies out there, and I'm not going to go down that rabbit hole for this talk, but there's a lot of publications and agencies who analyze those claims and provide evidence against them. I want to urge people to be wary of conspiracy theories and the sources that they disseminate, because a lot of them do sound really reputable, and there may be like little bits of truth that they're pulling from and manipulating. So be really careful and cautious about those, especially on social media. We have to understand where mistrust comes from. Systemic racism, mistreatment of people that are Black, Indigenous, people of color, LGBTQ, etc. It's prolific in the medical research. It is. There's no denying that people have a mistrust in public health, in government, and medicine. It's understandable. I teach a health and social justice course, and in teaching that course, even I go down a rabbit hole of being like, what occurred? Why was this ever okay, the way people were treated and are still treated? So I understand where that lack of trust comes from. People have concerns about the cost of getting the vaccine. It's free. It's absolutely free. And our education series website has so much information on that. If you've had COVID previously, it's important to talk to your doctor about getting a COVID shot and when the right time is for you, especially those that have been treated with it. Where can you get vaccinated? Well, this is for Santa Clara County. I work for Foothill College, which is located in Santa Clara County. But if you are watching this from another part of the state, another part of the country, ooh, that's awesome for one. But know that you can look at your own state's registry. You can Google your own state and see what they recommend. I actually quite like the bottom two, findashot.org and vaccinespotter.org, because they look at pharmacies and they do a really great job of getting you a vaccine appointment as soon as possible. myturn.ca.gov is a great option. So is vax.sccgov.org, that's Santa Clara County. But you can get a free vaccine. You don't need insurance. If you have concerns about documentation because you may be undocumented, you don't need to necessarily provide an ID or social security number. You have a right as a human being, if you're over the age of, if you're 16 or over, to get a vaccination. How will Americans know if there are safety issues with vaccines? So there's a couple of things that I want to talk about briefly. The Advisory Committee on Immunization Practices, they came together, especially after the Johnson & Johnson pause, but they're a group of medical and public health experts who develop recommendations and guidance for the safe use of vaccines in civilians. So we know that different vaccines are used in military, but we're talking about civilians. We're talking about the population of the United States. The VAERS system is the Vaccine Adverse Events Reporting System. I had a lot of fun, I'm not going to lie. I got to jump into this system because it's public for everyone. You can do the same thing too. I was able to filter and look and see how is it that adverse events are reported. I learned that anyone can report them, health professionals do, and all adverse events for any vaccine manufacturers have to be reported. So you can play around and find out, like, if someone got sick from after getting the vaccine, when was it, what were the circumstances? Also, did they have underlying conditions? A lot of times you'll see that not every adverse event is actually because of the vaccine themselves, and that's important to understand. It's important to get as much data from people as possible to understand why some adverse events might be happening. Speaking of adverse events, let's talk about the Johnson & Johnson Janssen pause. And if you're like, what is Janssen? I had that same thing too. I was reading and I'm like, what is Janssen? So Johnson & Johnson is like the one that owns everything. Janssen is a division underneath them. It's the same vaccine. It's just the Johnson & Johnson vaccine. So when the pause happened, like, why did they pause that? That seems like a big deal. And my ears perked up when I heard that there was a pause. So looking into it, there was a rare autoimmune response that was a combination of a blood clot in the brain with something called, that's CVST, cerebral venous sinus thrombosis, big fat word for basically a blood clot in the vein in the brain that allows your brain to drain blood. Because we know arteries carry blood into the brain, veins drain them out to the heart. That's a very simplistic description of that. So there was this clot plus thrombocytopenia, which is low levels of blood platelets. It could be indicative of bleeding inside. So why was this occurring? We know that CVST happens. We know that thrombocytopenia happens, but they were occurring together. How many people was it occurring in? Well, out of 6.8 doses, it was 6, not 60, not 606. So people were like, well, why did that cause a pause? Because it was a rare occurrence of these two occurring together collectively. So the outcome is 1 was a fatal case, 5 were treated and monitored and have been monitored or are currently being monitored, because this is all happening in real time. We know that these situations happen in women. So some people ask, are there any specific subpopulations happening in women? Will it happen in men? It is very possible that it will happen in men if it hasn't already happened in men. So it's not just necessarily specific to those that are identified as female at birth. So let's talk about what type of women was this happening in? Well, when you only have 6 cases and you're investigating, it's far too small of a population to make generalizations to everyone. And that's with any kind of study. A lot of studies talk about great things, but we have to look at the populations and can we generalize to the entire population? At this time, there is no and was no clear association. A lot of people say, was it birth control related? No, there's been no association with birth control. So for those that were worried about that, because blood clots happen, blood clots are really common. And a lot of people think women and think birth control, and no, the answer is no, there was no association with that. Just to alleviate concerns for my audience, especially those that are on oral contraceptives. So how common is this cerebral venous sinus thrombosis, this blood clot in the brain? So just occurring by itself, it's still pretty rare. The annual cases are about 2 to 14 per million people. So a very small percentage. If you're wondering what CVST plus the low platelets, those together, like what was happening with J&J, they don't annualize that because it is so incredibly rare. when we look at the rates, we can calculate for this occurrence in the Johnson & Johnson population. And remember, it was 6 in 6.8 million. This is what started the pause. Yes, it is very possible for more cases to come out. In fact, the FDA and CDC worked together on this, and they were encouraging physicians to report any more cases that may not have been reported through VAERS. So 6 out of 6.8 million, the occurrence is 0.00008% of those people that got the vaccine. So if you look at the death rate, because a lot of people want to know, if I get the vaccine, am I going to die of this? 1 out of 6.8 million is 0.00001%. Incredibly rare. I cannot even imagine how to calculate this in ways of like taking a person and being like, just, it's so incredibly rare. Let's talk about the reality. COVID has killed more than 569,000 or nearly 569,000 people. The blood clot from the J&J vaccine killed 1. And while that is sad, we know that not getting the vaccine is a lot more deadly and taking a risk and a gamble than gambling with a vaccination. The rate of death from COVID depends on age. We know that underlying conditions, all of those play a part, but we know that the rate is about 1%. And I know if my brother is listening to this, he's heard me say a million times, you can't take 1% for everyone. We have to stratify by the population. Certain demographics in our population have a much higher percentage than just 1. When we look at immunocompromised, we looked at underlying conditions, obesity, diabetes, etc. But if we go back to the basics and we compare that 1% chance of COVID death, and this is from people that actually get COVID, to 0.00001% from the vaccine, they're incomparable. The vaccine is a better option. So here's an illustrative example. This is the beautiful Bay Area. When we think about the population of the Bay Area is a little over 7 million. So it's like one person in the entire Bay. If we group everyone together, it's like one person actually getting this. So when and how often is this occurring after vaccination? Usually about 1 week after and not longer than 3 weeks after. So this isn't something that's happening 8 weeks, 9 years, 15 years down the line, because obviously we don't have that data, but this is happening relatively right after. Flu-like symptoms and headache are common. These are not something that I would be concerned about. These are expected reactions as the immune system is dealing with and getting fighter ready for COVID. The symptoms for concern for anyone that's going to get the J&J vaccine is things like severe headache, pain in your legs or abdomen, and what a medical provider would determine with medical tests, blood tests, including blood clots or low blood platelets. So if you have any of these severe symptoms, be conscious of them. And I'm only talking about Johnson & Johnson vaccine because this has not been reported in Moderna nor Pfizer. So should you be worried if you were vaccinated? I think that is really important to ask. If anyone's like, don't you worry about it, it's so rare. It's like, no, you should definitely pay attention to your body and ask yourself, like, how am I feeling? If you receive Pfizer again, that is not something to be concerned about. It's never been reported for Pfizer or Moderna. And we know that most people that have been vaccinated in the United States have been vaccinated with the Pfizer or Moderna vaccine. For those of you that have received the J&J vaccine, if it's been more than 1 month, the risk is very, very low. In fact, there's been no indication that it's happened in anyone in over a month. Within the last few weeks, monitor yourself for any of those symptoms, the severe headaches, the abdominal pain, leg pain, even shortness of breath. What to do? Immediately contact a health professional. If you don't have health insurance, visit a health clinic. Really just make sure that you take care of yourself and don't put it off. These symptoms are different than the mild flu-like symptoms. They're just not the same. Blood clot and flu-like symptoms are very, very different. So let's go back and ask ourselves, why did these events cause such a signal? Like for only 6 people, why are they being alerted? Well, analysis from CDC and FDA, they found that this really rare pattern occurred together. And it was actually similar to the AstraZeneca because they're both adenovirus vector vaccinations. So they have a lot of similarities. They're not the same type. They're not the exact same vaccine, but they have a lot of similarities. So this is something that caused a signal, caused a concern. And as a precautionary measure, FDA and the CDC paused the vaccine. They didn't stop it. A stoppage is different than a pause. So they needed time. What we need to understand, this pause was not, how should I say this? The pause was not consumer intended. This pause was to figure out what was going on, if there were actually more cases, and also to revise clinical guidelines. When someone has a blood clot, one of the most common things that a physician will do is administer heparin. So heparin is for the treatment of blood clots. It's a blood thinner. In this rare situation, when you have CVST plus thrombocytopenia, heparin is actually dangerous and it can be fatal. So what they needed time was, and it only took not that long, if you remember, it just came out. They needed time to revise the treatment, because the reality is the person that died from this most likely died from heparin, because that was the usual form of treatment. There is a better treatment, which now all clinicians are getting revised guidelines. So that way, when this does happen, because it most likely will happen again in a very few amount of people, they can be treated effectively. Clinicians can ask, have you been vaccinated with Johnson & Johnson? Oh, you have. Okay, so we're going to treat you with this instead of this. That way, the outcomes for the person are survivable and much better. So it's not to prevent this from happening. They didn't change the vaccine. They didn't revise the vaccine. They revised clinical guidelines so people have better outcomes when rare events happen, which happens with all kinds of medications and vaccines.
Hey, Rebecca, there are a couple of questions sort of related to what you're just talking about.
Sure.
So I thought it might be an appropriate moment to just get to them. So the first one was, how do you respond to those that believe the reason why the COVID death rate is so high is because many of those people that died had a different health issue and it was not related to COVID at all? And another one which says, if not every adverse effect is due to the vaccine and it could be an underlying condition, how do you respond to the death rate question that those who died did so because of the other health issue rather than COVID?
So a couple ways to answer that question. Yes, underlying conditions are really problematic. And this is a question that I feel like if I were to read who asked this question, I'm going to ask you, is my brother on the line? Because this sounds exactly like a question my brother would ask. So underlying conditions are things like when we say obesity, diabetes. These are conditions that were present in a person, but weren't at a point that led them necessarily to death, right? People with diabetes and obesity or coronary artery disease, heart disease, etc., we're not all in 2020 one day closer to death. COVID is so detrimental that with underlying conditions and having low health status work together to really push someone towards that death risk. Ram, can you address the second question? So I want to make sure that I get that death risk and that death rate.
The question says, if not every adverse effect is due to the vaccine, and it could be an underlying condition, how do you respond to the death rate question that those who died did so because of the other health issue rather than COVID?
Right. So was it the chicken or the egg kind of question? Was it diabetes and then they had a COVID infection, but it was really the diabetes, or was it really the COVID? And I think it's important to look at history, look at the CDC has database that is made public that anyone can go into. And what you'll find is that a high number of people that die of COVID-19, for example, also you see in their death certificates, or you see related as like pneumonia, where you don't necessarily see pneumonia or issues with breathing, ventilation with people that have these underlying conditions anyway. So working with COVID, these underlying conditions make a really horrific environment inside the body that makes it really unlikely that a person, especially when they go into severe COVID, severe respiratory distress, the need of ventilation, the inability to get oxygen, it really does kick them over the curve. But don't think that only people with underlying conditions are the people that have died from COVID. That people that were seemingly healthy beforehand have died of COVID. It isn't just one or the other, and it's really complex. I also don't have the answer to everything. So I'm not a physician, and I know that a lot of physicians can explain how, for example, diabetes maybe how that interacts with COVID-19 separately than heart disease interacts with COVID-19. So I don't want to implore the audience to think that I know everything about COVID, but we do know that people that had these underlying conditions we're not necessarily a day away from death or a year away from death. That COVID working with these underlying conditions was really tragic for them. I hope that helps.
Yeah, and there's another question which is kind of interesting, which is, does getting sick with COVID-19 provide better protection than receiving one of the vaccines? The second part of the question, I'm going to skip because it seems like that might be something to consult a physician. But the first one is an interesting question to ponder.
I love that question, and it's something I was looking at today actually in preparation for this, and it's somewhere in my like 70,000 references that I have, that people that do have COVID infection actually do, and I think I might have it in a future slide, they do have some antibodies against COVID-19, but they found that people that have even just one of the shots of like Pfizer or Moderna have a really strong defense comparable to people that have never had COVID having two. So I would not rely on COVID-19 or people that have had COVID-19 to rely on those antibodies, because you haven't been exposed to all the variants and you don't necessarily have antibodies to that particular COVID strain that you might get, or variant that you might get. Also, we do know that the vaccines are really, really effective in preventing. So again, relying on natural immunity is just not recommended within the literature.
And so what about mixing and matching vaccines? So a couple of people have asked this question. If you receive the Pfizer vaccine this year and you need to get another one next year, can you get the Moderna next year and so on? Or can you get the Moderna as the second shot if Pfizer is the first shot?
That's a great question that I do not have the answer to. I have heard like if you need to get your second dose and you've already had one mRNA, so you've had Pfizer and Moderna, you can't get the other. What's really interesting to come out is, for example, Pfizer is recommending that booster, that third one, within about 6 months. And again, things need to come out, and clinical guidelines need to be very clear about this. But it would be interesting to see if brand matters, if you need to stick with Pfizer, or you can go from Pfizer and next year maybe you get your J&J, maybe in the previous years you get Moderna, or in the next years you get Moderna. While I don't have the answer to this question, I, like you, have that question myself.
Well, the next one is very specific to Foothill College and sort of community colleges in general. Robert Cormier says, do you or would you support a COVID vaccination for Bay Area community colleges or all U.S. community colleges?
Well, here's the spot, and I'm on it. I would. As a public health practitioner, I understand and I see the differences in how vaccinating or requiring vaccinations for school entry. Obviously, there are small subsets of the population that can't get vaccinated. We have to account for that. We have to understand that. We can't just say 100% of people, but we see the differences it made with hepatitis B. I also see, because like I said, HPV vaccination is my Jimmy Jam. We see how such low uptake of HPV vaccinations in populations really doesn't, it helps the people that were vaccinated, but it doesn't make a huge dent when it comes to preventing cancers and preventing the ill effects of HPV. I see the skepticism, but just like CSU and UCs are requiring it, I would hope that the community colleges could also require it, but I'm not, I don't make policy. I'm not responsible for any of that. And I love my job so much that I hope what I'm saying is appropriate things to say at this time.
Yes, definitely. Thanks for sharing that. And let's go on to a different question. This one says, I heard you mention revisions to vaccines. Are we waiting on revisions to the COVID-19 vaccine before FDA approval? Or what still needs to be done in order for the COVID-19 vaccine to become FDA approved?
So the COVID-19 vaccinations, are you thinking of Pfizer, Moderna, Johnson & Johnson? There's four parts to a clinical trial, and I have that screen up. I do believe that there's been talk that the FDA will fully approve by summer. Dr. Sarah Cooper, I'm hoping I can bring her on the line to know if you have the answer to the question, if there's any other revisions that need to be done to the vaccine before full FDA approval, or if that's even a possibility, if it has to be intact as it is and they can revise later.
I'm here. I'm having some problems with my camera though, so I apologize for not being able to come on screen, but the FDA approval will come for the vaccine that's being given now, and the booster will be approved separately. So it will be a different spike protein, so a different shot basically, and it will be approved separately. It likely will not have to go through the same extensive clinical trials because the production will be similar. So it'll happen quickly, but it is not, the FDA approval is not contingent on the revisions being made in the vaccine.
So this question did not directly come up last week or this week, but what is the difference between the FDA approval versus the emergency approval?
Rebecca, you want me to, or you want to?
Yeah, go ahead, Sarah.
Okay, so the emergency use approval is not a full FDA approval. So it's a kind of approval that can be given when the trials have been done, but the time hasn't had enough. There hasn't been enough time. There hasn't been enough analysis by the FDA and the CDC, and the full approval is basically coming. So they've had a time for more people to get vaccinated now. So we have 250 million doses of these two vaccines that have been given at this point. And they've been able to review the safety data for all of those. And so there is a preponderance of data now that will allow them to give the full approval for the vaccine. And once we have the full approval for the vaccine, that's when we can start to have the kind of vaccine mandates that you're talking about with the CSU and the UC system, and hopefully the community colleges will follow too, so that we can have that full approval, which allows us to have the vaccine mandates.
Thank you both. All right, let's go to another question. This one says, if one person becomes COVID positive after the first dose, should the person take a second dose on schedule or avoid it or delay the second shot?
This is something that I would recommend that a person talks to a physician, a care provider about. There's a lot of COVID hotlines that you can access, but that is a question depending on your symptoms, depending on how you're feeling. I would highly recommend reach out to a physician if you are between those vaccinations. If you're a Pfizer, if you're Moderna, between vaccinations, reach out to a clinician. They're going to be able to help assess you the best.
And you had mentioned there was also some differences as to when people who have been previously COVID positive can receive the vaccine compared to somebody who's been without COVID entirely.
Oh, yes. So if you've had COVID and you've been treated for COVID, you've had medications, and if you're just not sure, talking to a physician is the best. They're going to be able to provide you with guidance to make sure that it is a safe time for you to take that vaccination.
All right. Might you know how long after a person gets their vaccine shot is the window that one considers if they're experiencing a side effect? Meaning 1 day or 3 days or what?
It's between 1 and 3 days. Most commonly 10 to 12 hours after that second vaccination is when most people start to feel a little icky. But then again, a lot of people don't feel anything from it and they're waiting and they're like, I think I might have a headache. Like, I think I might just, no, I'm actually pretty good. So yeah, I'd say about 10 to 12 hours is pretty standard, but about one to 3 days.
All right. This one's a good question about the Johnson & Johnson vaccine. This person says their friend got the vaccine and is a little nervous now. I'm trying to convince him. He asked me if he could continue to get other vaccines.
No, I mean, you've had Johnson & Johnson vaccine, you're good. I would wait until recommendations come out for how long it should be. Maybe you should get a yearly vaccine. I understand being nervous, but if you've already had the J&J vaccine and you're worried about the CVST plus thrombocytopenia, all you're going to be doing is monitoring symptoms for, severe headache, that abdominal pain, pain in the leg, shortness of breath. If you have had it, it's been over a month, then there's a very low risk. But again, if you're nervous, just monitor any symptoms that you may have and go to and seek medical help if you notice any of those big symptoms. But it's important to recognize it and to say, yeah, I'm nervous. I had this one and there was a pause. I think that's completely typical. And we've had that conversation within students in my contact tracing core that had the J&J vaccine and talking about what to look for. There's nothing wrong with taking time to pause and ask questions.
This next question's asking about the difference between the two vaccines. Pfizer and Moderna are both mRNA vaccines requiring 2 shots. What's the difference between the two? I'm imagining they're asking between Pfizer and Moderna. Is it just the origin, which company it came from, or are there any other differences?
So Dr. Sarah Cooper last week did a great presentation on vaccine, and she went in depth on this. So that's available on our site. Also, Sarah, can you quickly address the difference between Moderna and Pfizer?
Now you're on mute, Sarah.
I'm just not meant to do this today. Yeah, so I can address the differences. So the fundamental design of the vaccines is the same. So they both have the small piece of RNA that encodes for the spike protein for the virus. They both have a lipid covering, a fat covering that allows them to get into the cell. The formulation of that lipid covering especially is a little bit different between the two vaccines. But the general design is basically the same, but they are different formulations for the lipid covering for sure.
Okay, thank you. There's a comment from Christine Mangiamelli. I was told to keep the same vaccine for first and second. Next year will have to be explored. We'll just leave the comment at that. This is an interesting question, maybe a little difficult for us to answer, so let's try. Given that the vaccine is still only EUA, why is Foothill encouraging people to get vaccinated?
Who wants to take this one? Because I think we can all answer and address it, but Foothill, why we're having a vaccine education series, is we understand that vaccinations are the most powerful weapon that we have to end this pandemic. And I think we as educators, that's our goal in life, is to take what we know and what we've learned and disseminate that amongst everyone that we can, because we want our community to be intact. I don't personally want anyone to go through what my husband and his family had to go through with the loss of a family member, or to see this pandemic drag on and have children out of classrooms, having issues with mental, emotional, physical well-being because a pandemic is so horrific. That's kind of my perspective. Ram and Sarah, do you have a different perspective?
Yeah, I would just add to that. I think you answered it really beautifully, but just add to it that the science is totally clear. We are saving lives with vaccines, and the benefits of getting a vaccine and the lowering of your risk of really tragic consequences is demonstrably apparent. And you're not only protecting yourself, but you're protecting your community. So it's the reason that I'm standing here right now and encouraging people to get vaccinated and hoping that that message gets perpetuated to everybody is because the science is clear. It says vaccination is safe. It says it's the most effective way to get us out of this pandemic and to protect yourselves and your community.
Yeah. And I will say that our goal with this education series is simply that. It's to educate people about all the various pieces of information that is out there about vaccines. And I think that was exactly what Dr. Ryan presented today, with not just the COVID-19 vaccine, but also other historical information about previous vaccines and how they have helped not just prevent but entirely eradicate certain diseases. So that is the context that we are sharing with you, and hoping that this information is beneficial to you as a result. Maybe a couple of last questions. One here which says, there was a news that people who got the Pfizer vaccine might get a third shot after 6 months after the second shot. How long will Moderna vaccine work in against COVID-19?
The Moderna is also working on a booster shot, and the boosters are not actually to amp up your immunity against the current, so the vaccines were made against the original variant of COVID-19, the original variant of the virus. And these boosters are actually against the variants that are being made. And both Pfizer and Moderna are working on boosters. So I expect you'll see both companies come out with them.
Okay.
And I think that's important to understand, is that viruses naturally mutate. And so having really problematic variants is not a surprise. And what these companies are doing is they're developing boosters to help those, because like Sarah just said, the protection is for what originally was occurring. Now we've got some new variants that are coming out that are problematic and causing a lot of infection, a higher rate of infection and transmissibility. And that's what it's doing. And so while this pandemic goes on, more and more variants are going to come on the market. And either we keep in this cycle of variant, spread, death, or we work with vaccines and we work with, herd immunity to get people vaccinated, which decreases the amount of virus that's within populations, which decreases these variants. We can't just keep going in the cycle of just worrying about boosters and boosters and boosters. Vaccination really is going to be the key, but there's going to be some catch up played while variants are being worked out within boosters.
Diane points points out that it's very likely that full approval will come as early as 2021 or early 22. The data review is going as fast as possible because of how many lives are already saved from the past 4 months of vaccinations in the US, which also answers this other question about if the science is totally clear, why haven't the vaccines been FDA approved? They are in the process, and it's just the requisite amount of time that is required for full approval that we haven't quite gotten to yet. And I think we should probably end by this last comment, which says, thank you for the presentation. I learned quite a bit from this, and I want to join this person and say thank you, Rebecca, so much for your excellent presentation. This was very
informative. I do have a little bit left of the presentation, actually. Do you mind if I finish it?
If anybody wants to stick around, please feel free to. And we'll finish the presentation, the remaining, I think, 2 or 3 slides that are still left, and then wrap up the talk today. Go ahead.
And I will stick around for Q&A for those that want to or have questions. But yes, I promise it's almost over. I know a lot of you are like, when is this going to end? Let me continue from where I left off. So thinking about pauses within clinical trials, there were so many great questions about the J&J pause, but know that pauses have happened already with COVID-19. We just haven't heard about them to this degree. In 2020, Johnson & Johnson had to pause within their clinical trials. Eli Lilly and NIH's Active 3, and also AstraZeneca had pauses. So there are 4 phases in clinical trials, and I urge those of you that want to know about clinical trials and how they work to really do research on them, because I think why was it a pause and not a mandate? It's because the FDA and CDC understand that for the majority of people, this was not a risk, and therefore it was beneficial for the population. So doctors weren't stopping the Johnson & Johnson, mass sites were, but doctors weren't told to stop. So what we have to understand is that as of April 23rd, which what is today, was that, trying to look at the date on my phone. So 3 days ago, they announced that the pause was lifted. The Western State Scientific Safety Review Work Group also recommended the use of J&J. It wasn't just FDA and CDC. California will resume the use of the vaccine if they haven't already. So the final thing I want to talk about is addressing vaccine hesitancy. Instead of thinking about what can you do, what can we do? Get your second dose and any boosters. Educate other people, share resources that are reputable from reputable university sites, CDC, FDA, not Facebook, etc. Influence, especially young people, become an influencer for vaccines. Showcase friends and family who've got the vaccines. Talk about side effects, talk about the truth, the fear that you have, but also the reality and what's beneficial. Share websites so people can get vaccinated, and even help those in your social spaces with getting appointments, especially those that don't necessarily like technology. If you can go with them to a vaccine site, even better. And understand that the adoption of new ideas, technology, vaccinations is different for everyone. Some people have fear, some people have concerns, and to be in that space with them and let them share their concerns. Maybe they need a few more weeks or a few more months, but patience is really key while helping to educate and answer any questions that they have. So I turn the next parts to you, our remaining participants. What do you want in your life as a result of the end of this pandemic because of the vaccine? So find reasons. For me, I think again about my friends and family. I think about my father-in-law who we lost to this horrific virus. Because of the vaccine, I'd like to think about all these pictures. Where do you want to see yourself? What life do you want for yourself? And then a cajillion references. And that was pretty much the end of it. So those that just came back, I know that we have a few people trickling in. I'm going to go through where I left off again to help those of you, because I know it's a little spotty right now. So those that are coming back in, again, I want to finish the call for you, but are there any questions that are coming in about things that we talked about that we didn't have time for? Sorry again that it stopped so abruptly, but this is Zoomlandia where things happen. Okay, so
we'll post the whole thing on our website, so and the recording will be there. So anybody who didn't get to see the last couple of slides will still have an opportunity to do so.
Awesome. This is the biggest slide for everyone here. So for those that are trickling back in, this is for all of you. These are the things that we collectively can do, not individually, but collectively. Let's work on this collectively to ensure that we're helping other people, that we're being the helpers in the community. When something bad happens, what is it, Mr. Rogers, like his mom would say, When something bad happens, look for the helpers. There's always helpers. Let's be the helpers. Again, not everyone's going to understand the pause. Not everyone's going to understand. People are going to have their fears. Emotion is incredibly powerful. Learning about health behavior over the course of my career, I know that emotion is the reason why people do things, for the most part, well before logic. So understand the emotional reasons why people have to be hesitant about the vaccine, be hesitant about COVID, and to be wary of it. You may have people in your family and in social spaces that have gotten sick from COVID and survived, and they had diabetes. So what is the big deal? But no, that's not everyone's situation. All right, thank you guys so much. Again, if you have a question, please answer it or ask it in the chat, and I will answer it for you now. Ron, do we have any questions?
Yes, we do.
Yay!
What will be the best resources to send people to who are hesitant to get vaccinated, preferably other than the CDC because of mistrust with governing bodies?
You know, that is exactly what I have really spent a lot of time is like, people that seemingly are resistant to vaccines are going to be resistant to this type of education because, again, I'm quoting CDC, FDA, I'm quoting government and educational sites. And the mistrust and the distrust that occurs is understandable, right? Because government has messed up, public health has messed up a number of times. So you can understand why populations are skeptical when it comes to this. You understand that with the way that we have this dualistic notion within politics, we have this side and this side. We keep people on sides of fences, so we have to battle each other instead of collectively. I would say for people that are vaccine hesitant, ask questions rather than provide answers first. Listen to what the fears are. Does it sound emotional? Does it sound scientific? I don't necessarily have websites that do a good job of doing this, but I would go through, personally, I'm not an auditory person, but I am a visual. However, when someone has a storytelling approach, we know that in public health, storytelling is one of the most effective ways to learn and to disseminate information. So maybe it's through a TED Talk, maybe it's through a lecture like this, maybe it's through someone that they really look up to. That's why influencers are so important. I know when I say influencer, most people are like, oh yeah, that young generation. But people are influenced by anyone that they can relate to, whether it's a movie star, a music person, someone that they look up to, a role model. Whether you're 15 or 55, influencers are all around us. And to really look to that influencer and help people make that connection, bridge that connection. And also to show, of all the people in your life, look at how many were vaccinated and we're all okay. Look how little this number is compared to driving a car or having, burning your hand on a stove. What is the risk that really exists? And understand that a lot of people's perception of risk is based out of fear. And I get that. You want to know, is this thing really going to mess with me? And just empathize with people. That's my biggest response for that.
Great. Thank you, Rebecca. A couple of more quick questions, I think. During this pandemic, I have seen very little emphasis on healthy lifestyle and diet. One of the reasons the US has done so badly against COVID is our high blood pressure, overweight, obesity, and all of those things. I feel like we are being solely reliant on the vaccine. And it seems like it's not posed necessarily as a question, it's more of an observation. So I guess the person's asking that we rechannel our efforts towards a healthier lifestyle in general and not be solely dependent on just the vaccine.
Oh, barking up the tree of my whole career. We understand that individual efforts make a huge difference, right? Leading a lifestyle that's healthy. We understand that right now the emergency here is the pandemic. Getting people vaccinated is number one, but we can't ignore, like you're saying, healthy environments, choosing healthy fruits and vegetables, getting exercise, the really basic core things that can help a person be healthy. I think when you address this, you're kind of understanding that public health gets very little dollars. The amount of money that public health gets to do its job of helping societies is very little in a consumeristic, capitalistic environment where when you go into a grocery store, the mass majority of foods that are offered there are not healthy. They don't help people lead a healthy life. In fact, I taught health education in high school for 10 years, and it was a semester course, not a full year course. And it was only offered one time in a high school career. And that's not offered at every high school. So we understand that the United States in general does not have a lot of focus or vested interest in public health. We have vested interest in things that make money. Public health doesn't make a lot of money. So my reaction to that is absolutely encourage the people that are in leadership power to make public health related courses really, really important and vital for education. Understand that knowledge does not change behavior. I've worked my whole career in this. Knowledge does not necessarily change behavior. It's interventions over a long period of time that need to be properly studied and outcomes measured, and really true measurable outcomes. We have to understand that there are a lot of people that have unfortunate social justice concerns that are relevant. They live in food deserts. People that are low socioeconomic status don't have access to fruits and vegetables because of the food deserts. And what do I mean by a food desert? In low income populations, you have more fast food chains than you have grocery stores. How do people get their groceries? They can take public transportation, sure, but you can't buy in bulk. And so things are more expensive in walking distance and maybe a local bodega or a market versus getting fruits and vegetables from a grocery store. We know that Trader Joe's and Whole Foods are located in high income status neighborhoods versus low income. The list goes on, but I appreciate so much that you mentioned that a healthy lifestyle is an individual choice, but it's also the systems that are built around us that influence health, not just the individual.
All right. So we'll take one more question and then we'll wrap up. Do you know about any correlation between vaccine and autoimmune response?
Yes, the Johnson & Johnson is exactly that. It was this rare autoimmune response. That's what the CVST and the thrombocytopenia are. That was someone's rare autoimmune response. Other than that, no, I have not read or seen any other reactions to autoimmune response. But what I get from that question is if someone is immunocompromised or does have a history of blood clots or does have a history of underlying conditions, it is really vital that you talk to your healthcare practitioners about which vaccine is right for you. Maybe it's not the Johnson & Johnson, maybe it's the Pfizer or Moderna, but definitely having that conversation to make sure that you're a good candidate for vaccine, because not 100% of the population is a good candidate for vaccine, but the majority are, which I hope all of us in here are. Yeah. I hope all of us get it. That's what I'm hoping. And share this information. Please share this information.
All right. So, Rebecca, we'll have to thank you so much for this informative talk. And so we'll leave it at that. And of course, have your slides on our website, have the recording on the website for anybody else to go and enjoy. So, and to the audience, please come back next week for our third of the four-part series. Next week, we'll be debunking the myths around vaccines in general. So I look forward to seeing you all over there.
Thanks, everyone.
Thank you. Thanks, Rebecca. I think
Thank you.
I'll end the meeting now.
Okay, thank you.
Bye.